Vitamin D, it's everywhere, right? But so is a ton of confusion. So today, we're going to cut right through all that noise. We're going to give you a clear, science-backed guide on what it does, how much you actually need, and how to take it safely. Let's dive in.
So let's start with the big question, the one that gets all the attention. Could a simple vitamin really, truly upgrade your body's defenses against things like respiratory infections? Well, the science is pointing to yes. But, and this is a big but, the details are what really, really matter.
To really get a grip on this, we've got to start with the why. What is vitamin D actually doing inside our bodies? What's its job that makes it so crucial for our immune system?
Okay, so think of vitamin D as like a personal trainer for your immune system's first response team. It helps your body create these things called antimicrobial peptides, which are basically the body's own natural antibiotics. Super cool, right? And it also helps keep inflammation in check, making sure your body's response is strong, but not, out of control.
And listen up, because this is probably the single most important thing you'll hear about vitamin D, the part that most headlines just totally miss. If you're deficient, getting your levels back to normal is an absolute game changer. It can seriously lower your risk of respiratory infections. But, and here's the key, if your levels are already healthy, piling on megadoses doesn't seem to add any extra protection. The goal is just to be sufficient, not excessive.
So that's the big if, right? Which leads us to the next logical question. Are you getting enough? Let's break down what deficiency really means and, maybe more importantly, who is most at risk.
When you get a blood test back, these are the numbers you're looking for. Your level is measured in something called nanograms per milliliter. Now, anything below 20, that's a red flag. That's deficiency. But the sweet spot, the optimal range you're really aiming for, is right there between 30 and 50. It's a nice, clear target.
So who really needs to be paying attention here? Well, take a second and see if any of these sound like you. You don't get a lot of sun, which, let's be honest, is most of us in the winter. Maybe you're a bit older, you have a darker skin tone, or you're dealing with certain health conditions. Each one of these can make it way more likely that you're running low on vitamin D. All right, so maybe you're nodding along thinking, yep, some of that sounds like me. So what's the plan? Let's get super practical. This next part is all about the how, turning all this science into a simple, doable daily dose.
What the science is telling us now is actually pretty straightforward. For most adults, it doesn't matter if you're 35 or 75, a daily dose of 1 to 2,000 international units, or IU, is considered both safe and effective for keeping you in that optimal range we just talked about.
1,000 IU. Think of this as your foundation. For the average person just looking to support a healthy immune system, this is a fantastic, effective starting point.
And 2,000 IU? Well, if you checked one of those risk factor boxes we mentioned, like maybe you work inside all day, or it's the dead of winter, bumping up to this level is a really common and safe way to make sure you stay in that sweet spot.
And hey, here's a little pro tip for you just to make sure you're getting the most bang for your buck. When you're at the store, look for D3 on the label. That's cholecalciferol. It's the exact same form your body makes from sunlight, so it absorbs way better. And since it's a fat-soluble vitamin, taking it with a meal that has some healthy fat, think avocado, nuts, olive oil, is going to seriously boost how much your body can actually use. Okay, but before we wrap this up, we absolutely have to talk about safety. Because with supplements, it's so easy to fall into that trap of thinking, well, if a little is good, then more must be better, right? With vitamin D, that is definitely not the case. I love this quote from the medical literature because it just says it all, plain and simple. Once you're in that optimal range, the benefits of taking more they aren't there. This isn't about pushing your levels to the moon, it's just about fixing a deficiency if you have one. That's it.
So, is there a limit? You bet. Think of 4,000 IUs as your daily safety ceiling. For most adults, going beyond that every day, long-term, without a doctor telling you to, there's just no good reason. It doesn't seem to offer any extra benefit.
Now, when you get into really high doses, and we're talking way up there, like over 10,000 IU every single day for a long time, vitamin D can actually become toxic. This can lead to some pretty serious problems like nausea and even kidney issues. Now, it's rare, for sure, but it's exactly why sticking to those recommended doses is so important.
All right, that was a lot of info. We've covered the why, the what, and the how. So let's boil it all down into a final, super simple takeaway plan you can start using today. Look, it really comes down to this easy 3-step plan. First, just think about it. Assess your own personal risk factors. Do any of those things we mentioned apply to you? Second,
For general support, aiming for a daily dose of 1,000 to 2,000 IUs of D3 is a fantastic evidence-based target. And third, and this is the most important one, if you're really concerned, just talk to your doctor. A simple blood test is the only way to know for sure and get advice that's tailored just for you.
And that really just leaves us with one final thought. You have the expert guidelines right here in front of you. You know what to do. The only question left is a personal one. Do you know your number? Because finding that out, well, that's the key to truly smart supplementation. Thanks for joining me.